All right, everybody, back here. We've since then now moved from, we just got done doing some electrical stimulation and some ice, which felt pretty good. Helped my range of motion and immediate pain when I got up. Felt like I was moving around a little bit better. But as many people can probably relate that have something similar, one of the sensations I have right now is kind of a constricting, very pressure-like feeling in the front of the left hip, into the thigh. Not much in the lower leg, but in the glute and lower back. Very uncomfortable around the hip area. When I say the hip, I mean the hip, the front of the hip. Kind of help with some of the spasm, like I said, with the stim and the ice. So that's very good. I'll take anything at this point. And what I had done now, I had some of the staff put me on our spinal decompression table. I wanted to get, being that I kind of self-diagnosed myself with a little bit of a lower back disc injury, kind of vague, not sure what level. Based on my symptoms, I'm guessing anywhere from L3 to L5. Either way, at this moment, doesn't matter. Kind of treatment's going to be kind of very similar either way. But I wanted to get a certain kind of stretch going on the disc. If there is a bulge, decompression needed to get started right away. And that's kind of what I've had the staff put me on now, to kind of create a stretch decompression / traction effect on the lower back. And right now I kind of feel it stretching, feels nice. No pain. We start pretty low, as I've instructed the staff to place me on a low setting, just so that again, this is a pretty scary situation. I've been moving pretty slow, so I'm not sure what to fully expect at the moment. So we kind of have it on a low setting. We're going to kind of work our way up as far as the amount of pull. Now, I've had people in the past ask me with similar situations, well, what about an inversion table? Those tables that kind of flip you upside down. To be quite honest with you, as to what I'm feeling, that would be a pretty kind of scary thing, to turn my body almost completely upside down and hang off and decompress with my full body weight plus gravity and pulling on that what could be injured disc. It's kind of something that doesn't seem practical, and seems like it might hurt, because I've been walking around taking very careful steps, and that just seems like a very aggressive kind of very weighted type of effect that I'm not sure. So play it safe. We're starting out on this decompression. As I said, it's real low weighted pull based on my body weight, and it's going to gradually increase. There it goes again, if you can hear it. It's starting to stretch and pull a little bit more. It feels really nice, actually. Kind of taking a little pressure out of the leg, which is extremely nice. People may say, especially people that haven't been to a chiropractor, well, are you going to crack me or adjust me? And they feel like there's certain pressure in the lower back that just needs to be popped out. Well, having done this for 20 years, I don't even think that's a good idea at this point, right now at least. In time, that's going to happen, because we're going to need to make sure the mechanics are right in the lower back and there's proper motion in the joint. But right now, we're kind of treating the disc, and that's primary focus number one, is to try to stretch and pump essentially the disc in the lower back, because I'm guessing there's swollen, some strained fibers, and we need to put some gentle motion in there, and that's what's going to ultimately get me back to feeling where I need to be. So I'll probably be on here for about 15 minutes. No pain, very comfortable. And again, this is pretty much the protocol that we start out with when we see something like this. A disc injury or disc herniation, disc bulge, slip disc, whatever you want to call it, of this variety where there's symptoms, again, going down the leg. Oh, they're starting to pull again. Feels nice. No pain, because believe me, I'd be squealing if it was. Getting in and out of my car today was feeling that electrical pulling sensation down the back of my thigh into my butt cheek earlier. That was not pleasant. And so this is a welcome kind of addition to treatment. So we will be back. I'm going to let this go for a while and see how this does.